Friends, hello everyone. Today we'll figure out whether your pain is more likely caused by a hernia or if it's just regular muscle tension. We'll do 3 quick tests. For the first one, I'll ask you to lie down on the floor. Lie down on your back. Both of your legs should be straight. Keep your back straight. I will lift your leg to about 30 to 70 degrees. If I lift your leg, if I just feel some tension somewhere or a bit of discomfort, maybe a pulling sensation along the back of the thigh when I lift my leg higher, or some unpleasantness in the front, it's just muscle tension, the back might compensate. If I feel a shooting pain, then the test is considered positive because a hernia is a condition where the nerve root is affected and irritated. Accordingly, when we feel some radiating pain or tingling sensations in the body, a shooting pain or pulling sensation is always a neurological symptom, and this may be pain caused by a hernia. The second test, I will simply lie on my back, my legs are bent, my back is pressed down, and we either cough. Basically, if you cough or sneeze and feel a sharp shooting pain, most likely there is irritation of a nerve root. And I will do it like this. I just lie down, tense my abs, and exhale deeply. A deep inhale with the belly. Exhale. I just feel my abdominal muscles. And possibly, if my abdominal muscles are weak, I will feel the compensatory work of my lower back muscles. But if I feel any sensation in the buttocks area, that means I have a hernia. For the last test, I need a chair. I sit down. It can be a chair, a bed, or my knees. Fixed in place. It's better to place my hands behind my back. Then I round my back like this, relaxing my head. I need to sort of stretch out my spine. The task is to straighten my leg at the knee. I straighten it calmly. If I have muscle tension, I might feel a stretch along the back of my thigh or a slight discomfort. If I have a hernia and the nerve root is irritated, I will immediately feel a pulling sensation. This can be right from the lower back or through the buttock or along the entire back of the thigh all the way down to the heel. Friends, I really want to emphasize that we should not self-diagnose. These are just red flags for you to pay attention to and to consult a doctor or physical therapist. And now I will show you a short routine on how to help yourself in such an acute condition. It will be a gentle warm-up with breathing and a comfortable range of motion for you. First, I get on all fours, my right leg goes back, I stand on my toes, sit down, lower my elbow, with the other hand I reach forward and exhale. I rise up, inhale, tense my abdomen a little, step back with the other leg, sit down, stretch and exhale. Inhale and inhale. I don't make any sudden movements. It should be calm so that my nervous system has time to relax the muscle structure. Inhale and exhale. Exhale. Good. Next, I remain in this position as well. I'm on all fours and I'm going to do a cat pose with a neutral spine position. Spine. My back is straight. I inhale, round my back upward, head goes down, exhale. I return neutral. I don't need to bend too much. I always keep my back straight. I take a breath. Exhale. Inhale neutrally. Back up. Exhale. My task is to stretch my muscles a little. Exhale. We focus on rounding the back upwards. We did everything for 15 to 20 repetitions within a comfortable range of motion. Next, lie down on your back. This exercise can even be done in bed right after you wake up, and if you're not feeling comfortable, my back is pressed down and the task is to learn to move the hips. I start from a neutral position, tilt my pelvis toward myself, exhale, tense my glutes, tense my abs. Inhale towards myself, exhale, inhale, exhale, exhale. It's a small movement. I'm not even doing a glute bridge. I'm just moving the hip joint relative to the lower back. The goal is to put the load specifically on the glutes to relieve compression from the lower back. Exhale. And the last one. Exhale. Okay. The last thing we can do, we hold the leg with both hands under the knee. I inhale, the toe is relaxed, and I straighten it as much as is comfortable for me. Then I exhale. Here I feel the stretch. Hold for a second, lower it, inhale. Straighten, exhale. If you feel comfortable, you can straighten it more. Exhale, inhale, and exhale. In this way, we cannot aggravate this condition in any way. The only thing we need to do is to ensure the nerve glides relative to the muscles, because the muscular structure is dynamic while the nervous structure, it passes under the muscles, and we need these nerves to glide. Friends, stay healthy. May your backs always be strong, and may hernias never trouble you. If you need professional help, please contact us at our center. We are located in Ukraine, Poland, and Dubai, and all contact information for appointments can be found in the description below the title.